Hello, welcome to Burgess Falls State Park in Tennessee, about 45 minutes outside of Nashville, Tennessee. And I'll be sharing some trauma information with you today, including PTSD. Post traumatic stress disorder is a mental health condition that can develop in people who've experienced or witnessed a terrifying event. It's a significant and sometimes debilitating condition, but thankfully effective treatments are available. This video will provide a brief overview of PTSD, including relevant clinical information and current treatment protocols. PTSD can occur after experiencing or witnessing a life-threatening event such as combat, a natural disaster, a serious accident, sexual assault, or other traumatic incidents. It's characterized by a set of symptoms that can significantly interfere with our daily lives. Key symptom categories include intrusion, avoidance, negative alterations in thought and mood, alterations in arousal and reactivity. Intrusion is reliving the traumatic event through intrusive memories, flashbacks, nightmares, and intense psychological or physical reactions to reminders of the trauma. Avoidance refers to avoiding thoughts, feelings, places, people, or situations that trigger memories of the trauma. Negative alterations in thought and mood can include persistent negative emotional states such as fear, guilt, or shame, difficulty experiencing positive emotions, feelings of attachment, and being distracted easily or not being able to concentrate. Alterations in arousal and reactivity include the startle response, which is increased, hypervigilance or being constantly on guard, irritability or aggression, reckless or self-destructive behavior, and difficulty concentrating or sleeping. Not everyone who experiences trauma develops PTSD. A combination of factors, including the severity and nature of the trauma, individual vulnerabilities, and social support, can influence the likelihood of developing the disorder. Diagnosing PTSD involves a thorough clinical evaluation, often using structured interviews and scales for symptoms. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, provides the specific diagnostic criteria for PTSD. For a diagnosis, symptoms must be present for more than 1 month, often 6 months to a year or longer, and cause significant distress or impairment in your functioning. Neurobiological changes are also often observed in individuals with PTSD, which can include amygdala hyperactivity. The amygdala is involved in processing emotions, particularly fear. In PTSD, it tends to be overactive, leading to heightened emotional responses to perceived threats. Hippocampal deficits. The hippocampus plays a crucial role in memory formation. Reduced volume and function in the hippocampus has been observed in some individuals with PTSD, which may contribute to difficulties with memory and contextualizing traumatic experiences. Prefrontal cortex dysregulation. The prefrontal cortex is involved in executive functions, including emotional regulation. Altered activity in this area can impair the ability to modulate fear responses or think clearly. Changes in the hypothalamic pituitary adrenal axis. This system is involved in the stress response. In PTSD, there can be alterations in the regulation of stress hormones, like cortisol. Understanding these biological underpinnings helps inform treatment approaches. Current treatment for PTSD typically involves psychotherapy, medication, or a combination of both. Psychotherapy, talk therapy. Several types of therapy have been proven effective for PTSD. Cognitive processing therapy, CPT, helps individuals identify and challenge negative thoughts and beliefs related to the trauma. This type of therapy focuses on the meaning of the traumatic event and its impact on current life. Prolonged exposure involves gradually and repeatedly confronting trauma-related memories, feelings, and situations in a safe and controlled environment. This helps reduce avoidance behaviors and the emotional impact of trauma memories. Eye movement desensitization and reprocessing, EMDR, integrates bilateral stimulation, eye movements, with recalling traumatic memories to help process and integrate these memories in a less distressing way. TFCBT, or trauma-focused cognitive behavioral therapy, is often used with children and adolescents. This approach incorporates elements of CBT and trauma psychoeducation, as well as parenting components. Trauma narratives are often part of this effective therapy. Medications can help manage specific PTSD symptoms. SSRIs, antidepressant medications, are often the first line of pharmacological treatment for PTSD, helping alleviate symptoms of depression, anxiety, and hyperarousal. Speak with your prescriber about these. Prazosin, an alpha-adrenergic blocker that can be effective in reducing nightmares associated with PTSD. Combined treatment for PTSD is the most effective. Research suggests that for many individuals, a combination of psychotherapy and medication can be the most effective approach to managing PTSD symptoms and improving overall functioning. If you or someone you know struggling with symptoms that may be related to a traumatic experience, it's crucial for them to get professional help. Mental health professionals such as psychologists, psychiatrists, and licensed clinical social workers or therapists such as myself are trained to diagnose and treat PTSD. Reach out to this healthcare provider or explore resources like the National Center for PTSD as a first step toward recovery. With the right support and treatment, individuals with PTSD can experience significant improvement in their quality of life and learn to manage symptoms effectively. In conclusion, PTSD is complex, but it's treatable. Understanding its clinical features and the range of effective treatment options available offers hope for recovery and a return to well-being for those affected by trauma. Remember, seeking help is a sign of strength, and recovery is possible. Thank you so much for joining me today on Practically Social. Please like, comment, subscribe, and share this information to help the channel grow. I greatly appreciate it. See you next time on Practically Social.